Now the question of drive-up testing, that is now happening at hospitals in our area.
Beaumont hospitals in Royal Oak, Dearborn, Farmington Hills, and Troy are all screening curbside. It's limited though, so you must have symptoms consistent with coronavirus. Beaumont says to call its hotline first before trying to get yourself screened. It's a similar situation at McLaren Macomb, the hospital screening patients every day from 7 in the morning until 7 in the evening. This is in a tent outside of the Mount Clemens Hospital. Again, you have to show symptoms first. If you meet those requirements, and then the doctor will recommend you in for testing. And we know not everyone is going to meet those requirements based on their symptoms.
This morning, our Dr. Frank McGeorge did a Facebook Live question and answer session. He says to start with, don't rush to the hospital with a mild cough. You will likely be denied a COVID-19 test.
Don't come to the emergency department to be tested just for COVID-19 unless you actually have a serious illness.
The bottom line is that there are not enough COVID-19 test kits available to test everyone. You don't want to take hospital resources away from someone else who might really need them. So you are the first best judge of your own condition.
Use your symptoms as a guide. If you don't have any severe symptoms and it's something that you would, in the absence of this current pandemic, just stay home and tough it out, that's what I would recommend.
If you're concerned about your symptoms, contact your personal doctor and ask about your risk factor. If you have a fever, body aches, a new cough, and you meet the following guidelines, then you should be tested.
You are over 65, so you are at a high risk because of your age. If you are pregnant, higher risk because you are pregnant. If you are somebody with chronic medical conditions, diabetes, heart disease, lung disease, hypertension, cancer, that's high risk also. You would be tested.
A very important group is healthcare workers. If you have even mild symptoms, you are a candidate to be tested.
You do not want to spread infection to anybody. So if you are in a position where you are providing care to someone, I would consider you a healthcare worker, and you show symptoms, you need to know whether you have the illness, because you would want to quarantine and isolate under that circumstance.
Dr. McGeorge says the bottom line is take precautions. Wash your hands, clean surfaces at your work and home. Avoid close contact with crowds of people. Remember that we are all in this together.
Try and be kind to one another. We'll make it through this. We just have to do what we can in the community to help each other, help protect each other, help protect the vulnerable, first of all. But really, honestly, at the end of the day, we're protecting each other.
So much good advice in there. Now, I do want to mention on his behalf that Dr. McGeorge offered that Facebook Live session after he worked his regular job at the hospital into the very early morning hours. So, Doc, we hope you're not listening now. We hope that you're sleeping. And thanks for all of that valuable information.